Good morning. This study explored the impact of the COVID-19 pandemic on the education of children with special educational needs. It was conducted by a team of researchers from UCD School of Education, and Jennifer and myself are presenting here today on behalf of our colleagues. The empirical data reported here today is based on a triangulation of perspectives from principals, teachers, special education teachers, special needs assistants, students presenting with SEN and their parents, and from the full range of school types, primary, post-primary and special. The analysis includes primary data collected specifically for this study, along with secondary data previously collected as part of a Children's Schools Lives project, which is a longitudinal national cohort study of primary school experience being conducted within UCD School of Education. We are reporting from case studies conducted in 14 primary schools, in 4 post-primary schools, 1 special school, and 1 special class for pupils with autism. A total of 97 interviews were conducted in these schools. Surveys were completed by a total of 343 school principals across all 3 school types. Overall, we are reporting data from a total of 415 schools. As I said, the data here is being combined with an existing project called the Children's Schools Lives project. The CSL project was ongoing at the time of the outbreak of the COVID pandemic and the related school closures. Data were collected at that time on the impact of COVID on the general primary school population. As part of this current study, that data was further statistically analysed with a particular focus on the impact on students with SEN attending primary schools. Secondary data from 175 primary schools were analysed as part of this project. We are presenting only the preliminary findings from the project here today, beginning with the theme provision and supports. Readiness for school closures. Schools generally reported not being prepared for the lockdown, although some schools were somewhat more prepared than others due to existing use of digital technologies, such as using iPads in schools. Teachers spoke of having to be creative to adapt their teaching to remote learning, including working with parents to create learning materials to engage children. Some members of staff spoke of their own shortcomings in the use of technology at the start of the school closures.
In our survey of principals from primary schools, post-primary schools and special schools, we asked principals to rate whether they had used different types of pedagogical approaches during the lockdowns. And here, just to show you the general patterning, the approaches of using digital technologies, digital learning platforms, video calling, chat applications, and giving iPads and tablets to students was used more often by the principals in post-primary schools. Whereas the principals in special schools and primary schools, more of those principals reported that schools were using worksheets and workbooks to give home to students. And also the SNAs and teachers were visiting students' homes. So there was more prevalence of face-to-face contact and paper-based methods for learning in the primary schools and special schools during the remote learning experiences of the first school closures. Back to me. Principals also reported on the school's usage of external supports during the school closures, supports from many national agencies. And there, the principals in post-primary schools reported using these supports the most, whereas principals in special schools reported access to and using these supports the least.
It is important to remember that while the general population of students experienced the loss of school support in relation to teaching and learning, pupils with significant disabilities, especially those in special schools, also lost the support of the therapeutic services. Parents spoke about the massive relief on resumption of these supports and including the return of respite services after the second lockdown. We will now explore the theme impact on children's learning.
In our principal survey, principals were asked how many children accessed learning during the periods of remote learning in school closures. And most children in the primary schools and post-primary schools without special educational needs were reported to have accessed remote learning. However, these numbers were much lower for children with special educational needs in primary schools, post-primary schools, and special schools, with principals generally reporting that only half or actually under half of children, especially in special schools, were accessing remote learning during the periods of school closure.
We now focus on children's experiences of remote learning. Some students reported significant difficulties in learning remotely and how they missed the classroom and the support of school. And they admitted to missing it more than they would have expected to do so. However, other students enjoyed learning in the comfort of their own homes, the independence and the flexibility it brought. And actually, some would have been quite happy not to return to school after lockdown. A very small percentage absolutely thrived on learning online, according to a post-primary teacher, a post-primary special education teacher. So what did the students need while at home? Students and parents emphasized the need for parental support during remote learning. And of course, while some parents had the resources, the time, and the capacity to do this, others struggled to do it due to work and family responsibilities, the availability of resources, technological devices, internet quality, availability of study space, and competing demands from other family members for these resources were all factors impacting on the remote learning of experiences of pupils with special educational needs.
When schools reopened, principals reported that the attendance of children with special educational needs, for the most part, was similar to how it had been pre-pandemic for children with special educational needs in primary schools. However, the attendance was reported by half of the principals in our survey in post-primary schools as being lower, and by the majority of principals in our special schools who were surveyed, they also reported that the attendance of children with special educational needs was lower post-pandemic.
Staff spoke about a general decrease in attendance on reopening, and that was applicable to all students in the schools, due to a combination of public health guidelines regarding isolation, as well as students no longer wishing to attend school. Some had got in the habit of actually doing some work and wanted to continue working. Some had concerns about returning to school because of perceived health risks. Obviously, the fear of contracting the pandemic was a major issue for a number of students, especially students with special educational needs, and especially students presenting with autism. Some students had concerns for family members, especially elderly family members such as grandparents, and the fear of contracting COVID and bringing it home to parents and grandparents.
In the survey of principals, principals were asked to rate the impact of the pandemic on children's learning for children without special educational needs and for children with special educational needs. Now, most principals across the board rated a moderately negative impact, but the principals rated the impact as being the most negative for children with special educational needs in post-primary schools. followed by children with special educational needs in primary schools and special schools, compared to children without special educational needs in post-primary and primary schools. Using the Children's School Lives data, we also asked parents, teachers and principals how concerned they were about the negative impact of the pandemic on children's learning. And using statistical analyses, we found that parents were more concerned, they had higher levels of concern about the negative impact of the pandemic on children's learning if their child had a special educational need. Likewise, teachers were more concerned about the negative impact of the pandemic on the learning of children if they had a greater proportion of children in their classroom who had special educational needs. And similarly, principals were more concerned about the about the impact of the pandemic on the learning of children in their school if their school had a higher proportion of children with special educational needs in the mainstream primary sector. Principals in the principal survey were also asked to list up to 4 different responses that they had to regression in learning for children with special educational needs. And more details about this can be found in our report, which is forthcoming. So principals reported the most frequent response to regression was actually well-being accommodations, followed by the use of class hours, an increased focus on learning and learning supports, and also parent-school communication and learning assessments. Now, the wellbeing accommodations were reported more frequently by principals in special schools, and principals in special schools and primary schools also more frequently reported use of class hours, whereas principals in post-primary schools more frequently reported a focus on lessons and learning and teacher support and parent-school communication.
The concerns then around regression in learning, and teachers and parents expressed concerns about the apparent widening of the attainment gap between students with and without special educational needs, with a perceived greater level of negative impact on students with SEN. Parents of pupils in special schools spoke of their children regressing and forgetting what they had previously learned in school prior to the pandemic and the school closures. And our next theme is the impact on children's well-being.
Principals in our survey were asked to rate the impact of the pandemic on children's well-being. And again, similar to the impact of the pandemic on children's learning, principals were most likely to suggest that there had been negative impacts for children's well-being for children with special educational needs in post-primary schools. And this was followed by negative impact for the well-being of children with special educational needs in special schools. Then the principals of post-primary schools also reported relatively high levels of negative impact for children without special educational needs in post-primary schools. We also asked principals who were surveyed, principals of special schools, to rate the impact of the pandemic on children's well-being for children with different categories of need. And here we've ordered the responses actually to shed some positive light here, where we can see that actually the principals in the special schools, many of those principals suggested that the pandemic had had a positive or a mixed impact on the well-being of children who are blind or visually impaired in their schools, who have severe and profound general learning disability, deaf, hard of hearing, physical disability. And although the majority of principals of the special schools suggested that the impact of the pandemic on the well-being of those children was negative, I'd just really like to highlight here how many principals did also suggest that it had a mixed or a positive impact for children with certain categories of need. However, the picture is quite different for children with emotional or behavioural problems, either severe or moderate, and children who are socioeconomically disadvantaged, where most principals in special schools rated that the pandemic had had a very negative impact on the well-being of those children, which leads to further questions about the intersection of emotional and behavioural difficulties and socioeconomic disadvantage. With our Children's School Life Study data, we again asked parents, teachers and principals how concerned they were about the impact of the pandemic on children's well-being. And here, similar to the impact of the pandemic on children's learning, we found that statistically, parents were more likely to express that the pandemic had had a negative impact on children's well-being if those parents had a child with special educational needs. And principals were also more likely to say that the pandemic had had a negative impact on children's well-being if they had more children with special educational needs in their mainstream primary schools. However, the picture was different for teachers, with no difference being found in the ratings of teachers on the impact of the pandemic on children's well-being, depending on the number of children with special educational needs in those teachers' classrooms. So we like to think that teachers were remaining very positive about their ability to care for children in their classrooms, regardless of children's special needs characteristics. This analysis here was done with several thousand children from the Children's School Life Study, who the children themselves and also their teachers were asked to rate the children's well-being pre-pandemic and school closures in 2019 in spring, and post-school closures in 2021 in spring. And through analysis of these data, we can see that there were already differences existing pre-pandemic, with children rating their well-being and academic confidence, for example, and levels of victimization as being higher pre-pandemic if they had special educational needs compared to if they did not. And also teachers rating children's emotional and peer problems and conduct issues, and also children's hyperactivity as being higher pre-pandemic. But what we did was we did an analysis where we controlled for the differences pre-pandemic between children who did and did not have special educational needs, to look at whether or not there was a change between these groups, whether the differences widened or not across the school closure period. And what we found in children's reports was that for children who were rated by teachers as having emotional behavioural difficulties, that in fact the differences in their well-being, and these are differences where the children had lower levels of well-being, increased between those with and without emotional behavioural difficulties and children without any special educational needs at all. Also, the differences in academic confidence increased as well, where the children had more negative perceptions of themselves as learners, and children with emotional behavioural difficulties were more likely to report higher levels of bullying, and these differences increased across the pandemic. For children with special educational needs rated by their teachers who did not have emotional and behavioural difficulties, these differences were also there for well-being and for academic confidence, but not for bullying or victimisation. And there were no differences in school engagement between children with and without special educational needs across the pandemic years. In the teacher-reported student well-being, the teachers reported, as I mentioned before, emotional and behavioural, conduct, hyperactivity, peer problems as being higher for children with special educational needs prior to the pandemic and school closures. And teachers' ratings suggested an increase in the differences between these groups across time, with further development of emotional problems, peer problems, and hyperactivity for children with special educational needs with and without EBD, and for children with conduct problems who were rated by their teachers as having emotional and behavioural difficulties across time.
Continuing on the theme of children's emotional functioning, pupils with special educational needs varied in their emotional responses to school closures, but they reported a range of emotions, including anxiety, stress, boredom, cabin fever, confusion, some happiness, others loneliness and isolation. Many parents and teachers reported increased anxiety among students with SEN during the lockdown. In relation to their social functioning, participants reported an increase in social anxiety and a decrease in social skills amongst pupils with SEN, saying some students had lost a lot of the skills they had previously demonstrated. In the post-primary setting, both students and parents reported that students struggled socially on returning to school. And principals would have commented that there was kind of a general reduction in confidence and in and general behaviour of students across the school population. So this was not necessarily confined to students with special educational needs. In relation to behaviour, participants from the special school and the special class settings in particular reported that behaviours both repetitive behaviours which increased and independent skills which were reduced, that these behaviours, general behaviours, had all deteriorated during the lockdown. On transitioning back to school then, participants reported that while most students transitioned back into school quite easily, or else found it difficult initially, most adapted within a few weeks, but some students with additional needs struggled with the return to school, and some did not want to return to school. So looking forward.
In our interviews, we asked children and parents if the lockdowns were to happen again, if schools were to close in future, what would they suggest would be helpful? And children and parents had many ideas, only a few of which are captured here. They suggested further training in remote learning for parents, students and staff, to provide more supports to students with special educational needs when they are involved in remote learning, and this is for children especially in post-primary schools. Increased school and home communication. There were also issues around balancing workload and timetables in post-primary schools, where because of the subject specialist teachers, it appeared that there wasn't a connect between one teacher's knowledge of what a child was being given in one class versus in another subject. So there were issues around workload and timetables. Also that schools should continue to use technology in the classroom and to establish routines for learning at home early on. We also asked principals in our survey about what they might recommend for future emergency responses for the nation in the case of another pandemic or return of this pandemic or other types of emergencies for encouraging the provision and supports to continue for children with special educational needs in the education sector. And principals suggested many things, some of which are on this slide here. And just to note here that in terms of the most popular choices that principals suggested, additional hours and support, supporting children's well-being, additional staff in schools, more communication with parents, and a gradual transition back to school, which was seen as very important. And these additional supports were reported at similar levels of frequency across primary, post-primary and special schools. However, special schools did ask for more additional hours and support for SEN, as did primary schools compared to in post-primary schools. And post-primary schools were more likely to ask for additional support for children's well-being.
So in summary, schools were generally unprepared for school closures, but better prepared second time around. Schools did employ a range of pedagogical approaches, and again, the impression from parents was things worked much better during the second closure than the first one. Professionals from the principals in the special schools did not report accessing as much external support as much as other schools, and that's something I think that we need to tease out further to see what the context for that was. Schools employed a range of responses to regression in learning post-returning to school, including extra tuition time and well-being interventions. In general, there was a mixed experience of remote learning, but overall, less participation in remote learning among students with special educational needs, most significantly lower in the special school and then in the post-primary school and then the primary school. In all cases, the participation and engagement of students with special educational needs was less than students without special educational needs in either the primary or the post-primary setting. There are concerns about impact on learning amongst pupils with SEN in post-primary schools, and maybe that's a cohort that emerged as of particular concern that we may not have anticipated. Concerns around the widening gaps in attainment between pupils with and without special educational needs. Impact on children's well-being. Concerns about well-being of pupils with special educational needs. Reported increased emotional conduct and social problems, and increased hyperactivity amongst those tending to display that behaviour. It resulted in poor academic self-confidence and regression in behaviours in a number of presentations, especially for pupils in special schools and special classes. So to sum up the lessons that we may kind of be learning from this, teachers need continuing professional development in relation to the delivery of remote education. There's need for enhanced training and technological skills for students with SEN. There is need for more target and intensive support for students with SEN in the event of school closures, with particular focus on students attending special schools and special classes. We might want to pay particular attention to younger children and students presenting with social, emotional and behavioural difficulties. They need prioritised attention during unanticipated school closures, and especially particular attention for students with autism. There was particular challenges for schools in delivering tuition in practical subjects during the school closures. That, of course, would apply to students with and without special educational needs. There would be need for more targeted support for schools that are serving disadvantaged communities. The issue of communication between schools and students with SEN during school closures would need particular attention. And parents were indicating that schools were very often communicating directly with the students, and they themselves were somewhat out of the loop and weren't exactly sure what was going on or what was required of the student. Some of the students were happy to declare they had no work to do, when actually that wouldn't have been the case. So there would be a need for a coordinated approach to school-student communication during any such closures. The mental health and well-being of students with SEN would need particular attention, as well as to academic issues. And there would need to be targeted support for students with SEN who are returning to school after prolonged, unanticipated closures. And schools would need additional support from agencies within the education and healthcare system to provide additional support to our most vulnerable students during any future unanticipated school closures. Thank you very much for attending here this morning. I want to say thanks to the NCSE for putting their trust in us in doing this project. I want to thank my colleagues who are named on the slide here. I also want to thank our signers for doing a fantastic job here this morning during this presentation. Thank you.